Hi everyone, welcome to our Azure Developer Community podcast series, and we are back with yet another podcast. Today, we have with us Gaurav Jain, who has amazing experience, and also currently he is a senior vice president at IKS Health. And also apart from that, when it comes to his experience, he is currently leading a very strong technology team that has been instrumental in the design, development and delivery of emerging technology solutions and services that actually support the full spectrum of IKS health services and its expanding businesses. So I welcome you, sir, to the today's podcast.
Thank you. Appreciate it.
Yeah. So yeah, let's start with what is actually IKS doing, and also um, would love to know about the founding members as well.
Sure. So I think it's an interesting story. In about 2006, two enterprising professionals sat across a table in a coffee shop one day, and uh, as they assessed the challenges faced by the U.S. healthcare uh, in in general, they recognized the 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 growth potential, in creating solutions that the then healthcare system was challenged with in revenue cycle management. So they drew up a plan, literally on a piece of paper, as they discussed and debated and reasoned the composite of their dream project. And Sachin Gupta, founder IKShealth, and Joe Panditello, co-founder of IKShealth, sowed the seed of an organization that would become the name in the healthcare, on the healthcare space. Today with nearly 6,000 employees, four significant lines of businesses, about 800, 900 odd physicians, 500 clinicians, 300 and plus technologists. So yeah, that's a little bit about who we are, and a little bit about Sachin and Joe, and how we came across as an organization.
That's actually pretty huge and also amazing at the same time. And like um uh, like as you mentioned that it's a big organization. So when the pandemic happened, so was it difficult for you to handle it? Because again, we have like hundreds of employees, so like turning up from offline to online, so was it difficult, and how you actually handled that situation?
Uh, Actually, I mean, like every organization, we were challenged with it initially, and healthcare industry in general is very, very regularized in the U.S., and there are a lot of rules and laws. But I think, given that we've been a fairly tech-led organization, we had a lot of our infrastructure in place, and I had to activate that. And we adapted. I would say we adapted to the new working paradigm fairly well, and were able to sail through the pandemic. Keeping both our employees safe, and at the same time making sure our clients were well supported, and we're still able to focus on providing better, safer, and more efficient care for their patients.
That's really great. So, as you mentioned that it's the health sector. So, would love to know more about the health sector and also how actually the health industry works, because ultimately, when it comes to health industry, various people out there are still confused how it works. Like, is it difficult to upscale? So, how it actually works?
Yeah. So, I mean, I think we're talking specifically about. I'll talk specifically about the U.S. healthcare industry, because that is where IKS is focused, and like I mentioned earlier, we're centered around U.S. healthcare. And I mean, I'll give you some stats that I think will help answer some of the questions you have. Right? I mean, the healthcare industry is massive, right? I mean, just in 2020, the healthcare spending in the US was 19.7% of the GDP, of the US GDP. And that's about the expenditure was about $4.1 trillion in 2020, and which is about $12,530 per person, and it's expected to reach about $6.2 trillion by 2028, as per the Centers of Medicare and Medicaid Services. So, yeah, I mean, it is massive. It's got massive opportunities, and it is definitely a fast growing sector that spans across healthcare insurance, healthcare marketing, pharmaceuticals, healthcare tech, health administration, and so on. So, the spectrum is wide, and there's a um, lot of challenges to be solved for, and a lot of problems to be answered, and solutions to be created, and thus the opportunity is massive.
That's pretty true. And also, like as you mentioned, yeah, like healthcare industry is massive and it's very like huge. So, like about that, as you said that there are various challenges that you actually face when you are working with the healthcare industry. So what are the myths and misunderstanding people has in their mind when it comes to healthcare industry, and at the same time, like there might be various myths the founders might be having before starting or like putting themselves into the healthcare industry. So what are those?
Sure. So I think, especially U.S. healthcare industry, there's a myth that it all operates very seamlessly, and it just it's all hunky and dory. Whereas the fact remains that there is a lack of right data available at the right time to all stakeholders in the care delivery system, and uh, different stakeholders are impacted differently. For patients, it affects it affects safety, because their social or medical history is either not recorded or not available in electronic form, which could lead to clinical errors. Right? Physicians spend more time recording tests or searching for results, which could result into delays or errors in medical judgment due to lack of all the information related to the patient. Right? Overall, it increases the overall cost of care, because now you're doing duplicate testing, repeat diagnosing, and things of that nature. So, it's important for healthcare enterprises to make that journey from digitization of all the data to where it is stored in electronic format, to digitization of data such that it is stored, classified, and available in the right discrete structures to leverage advanced data science tools to enable the digital transformation of how care is delivered. So that's from my perspective. When I talk to industry leaders, the myths they have, and what they think, when they think that, hey, does it all work, and it all works seamlessly. So that to me is the biggest opportunity, and of clarification, if you wish.
Exactly, exactly. So, as you mentioned about the challenges and the myths, basically. So, in that case, we see that nowadays technology is going amazingly in every sector. So, how technology is now how the current technology is helping you in the health industry, and what do you see that how technology would be helping you in the future as well, or would it be a really great game changer for the healthcare industry?
Absolutely. I mean, technology is centric to everything today, right? And the three most defining aspects of healthcare are quality, affordability, and accessibility. and that is at the fulcrum of how we architect patient-centric solutions in the future. It's all pointing to a rapid and urgent adoption of technology, and there are solutions that are available that provider can look for underburdening these administrative tasks as they concentrate on what they do best, which is caring for the patients. Trustworthy integrated partners that can pick up these three aspects of patient care, improving patient experience, mitigating errors, and unburdening physicians, is really the light at the end of the tunnel for provider enterprises. And that's not going to happen without the help of technology. That's only going to happen with the help of technology, whether it is legacy technology or you know more emerging technology trends, i.e., cloud, machine learning, data science, um, m- you know, uh, m- m- uh, process automation, things of that nature.
That's actually pretty much true. And what do you think that how youth is currently looking forward to the healthcare industry? Like as we just talked about that technology is helping a lot, and also it's gonna be a really big game changer in the future. So what
Mhm.
like from your experience, how youth is currently seeing healthcare industry, and what would be the future of it?
Yeah, I mean, look, I think healthcare, like I already mentioned, the future is really, really vast, right? There's tons and tons of opportunities, from for for the youth, whether they are physicians, whether they are clinicians, whether they are, from other streams of education, or they are, obviously technologists, and we've talked about technology and the impact of technology on healthcare. So, I think there's tons of opportunity given the size and what challenges the healthcare has. We as an organization are constantly adding more physicians to our install base and expanding our solutions at the same time to these clients. And via that, we're creating many jobs in India and adding numbers to our growing workforce, which is already 6,000 plus, at this point in time.
That's so true. That was the really great point that you just shared with all of our listeners as well. So how as a leader do you see yourself as an ingredient, when you see yourself like, yeah, and right now you are working with IKS, and you are doing a really great work. So um like um, what are like when it comes to your leadership skills, and about your abilities. Okay, so how you actually handle everything at the same time, and how your schedule looks like.
Yeah, I think I'll answer this a little differently, right? Not sure if my schedule will help you, but I think, as a leader, I strongly believe, that I want to inspire and motivate my teams to do the best, right? I've, I've sort of, s- kind of strongly believed in this, approach that is defined by a three-pronged approach that's defined by Daniel Pink. And according to Pink, the intrinsic motivation is based on three key factors: autonomy, mastery, and purpose. Autonomy is is the need to direct your own life and work, right? To be fully motivated, you must be able to control what you do, when you do it, and who you do it with, right? I mean, this is exactly what today, when you look at the millennial population, their biggest ask is autonomy. Mastery, again, mastery is the desire to improve. If you're motivated by mastery, you'll likely see your potential as being unlimited, and you'll constantly seek to improve your skills through learning and practice. Someone who seeks mastery needs to attain it for its own sake, right? So learning and practice are critical. And we've seen the advent of the self-learning and the current, you again talked about youth, how they want to go ahead and master techniques and technologies and whatnot. So that's an important aspect. And then you know people can become disengaged and demotivated if they don't understand, or can't invest in what the bigger picture or the purpose of what they're trying to do and what they're trying to solve for. So at IKS Health, we are all driven by our single purpose, which is to enable provider enterprises to deliver better, safer, and more efficient care.
That was too good because that's actually pretty much true, and at the same time it is very much like important for the people to understand this and like stay motivated alongside. Like I guess like before concluding this podcast, I am pretty much sure that the listeners would be very much happy to know one more thing from you is like what tips you would be like giving to a person who wants to step into the healthcare industry, or like who wants to like explore this industry.
So, I think steps to explore healthcare industry or people that are looking to participate in it. I think my only message to them is the opportunity is massive. I would not hesitate to participate and become a part of this industry. It's like we've discussed throughout this session. There's tons and tons of opportunity. And irrespective of what your education background is, there's space for each and every one of them. Whether you're a management graduate, whether you're a clinical graduate, whether you're a doctor, whether you are a technologist, opportunities. Opportunities are massive, and I think the most beautiful part of being in healthcare that you will find is the purpose that you're trying to solve for. So I would say find your purpose, and you'll find the purpose that you want to go after, and that'll make that your north star, and that'll drive you to what you want to accomplish within the healthcare industry.
Thanks a lot for that, and I am pretty much sure that listeners would be benefiting a lot from this podcast, and they would be loving it so much because we got to know a lot about the healthcare industry and how IKS is also working, and at the same time, they got the motivation as well. So yeah, thanks a lot, Gaurav, for joining in for the today's podcast, and it was really great having you today.
Thank you. Appreciate it, Chavi. It was nice talking to
Thank
you.
you so much. We would surely be coming up with another podcast just like this. Stay tuned with us.